So, welcome students. Sorry, because we had some technical errors. So, because of technical snag, we have started now. So, first of all, I seek sorry from all of you because of technical snag. So, we will start this lecture. It's a very simple topic and it is a need of the hour also. So, we will talk about these things. So, for this I have given the name, it is Vision 2020 for Ayurvedic graduates. So, my PPT is ready. So, I will share my PPT to all of you on AKVP web page. So, now you can see me only, but my PPTs are not available. So, I can show you my PPTs and share it on AKVP web page. Okay, so first of all, I welcome all of you. Thanks Shamanta, Vinita and all AKVP activists for their untiring effort to air this presentation to all of you. So my welcome to all of you. So there are hundreds of opportunities are there. To get these opportunities, first of all, we have to think beyond ourselves. Because traditionally we think that Ayurvedic graduates can have a clinic or can go for the academic things. But we have to be very careful to choose other things. To go for these things, we should have three important things. One is skill, the second one is our attitude, education. So, after finishing BAMS, you are having your knowledge pool is available with you, but I am having little doubt about this skill. Now you have to develop this skill. Your attitude also, because some of us are emotionally bound to Ayurveda, but this is not needed now. We have to work with our skill. Emotion should be there, but emotion should not be 100% emotion, but system. So think beyond yourself. This is the message for all the students, because you have to think beyond yourself. Then only you can survive. So when you think beyond yourself, first thing you observe is sky is the limit for your success. You can aim to touch the sky. That is the thing. So to begin with, I will start my lecture with objective of this talk. So firstly, we will evaluate the present scenario first. Then we will evaluate what are the opportunities are available. I have subdivided the opportunities. What are the opportunities available in government sector? What are the opportunities available in private sector? What are the opportunities available in allied science like biotechnology, forestry? There are many such areas are there. And recent innovations from Government of India, recent innovations from Government of Karnataka, recent innovations in research, and lastly I will end my topic with the recent scenario. What are the opportunities available for all of us in COVID-19 situation? So this is summing up of my topic today. So all these 7 aspects I will talk with you. It will be a discussion. You can ask any question. In between also you can ask. Before I start my talk, but generally present status I just wanted to talk. There are more than about 425 colleges, Ayush colleges are there in our country, and most of the Ayurvedic colleges are there in Maharashtra, Karnataka, Uttar Pradesh and some of the states. So we are having more than about 15 to 16,000 graduates coming out of these 400 colleges every year. And more than about 4,000 PG scholars are coming out of these colleges. More than about 500 PhD scholars are coming out of these colleges. And now my question for you is that what are the opportunities are available for these graduates? I am talking about the present scenario. If I look back, there are more than about 8.5 lakh Ayurvedic doctors who are practicing in all over India. So many of them are facing problem now, and what are the opportunities available for them also, we will talk about this. Then, so when I see all these areas, the first question arises in my mind is that opportunities are nowhere. Nowhere opportunities are available. So you are having only two opportunities. Either you have to open a clinic or you have to go to a college. Now, after my talk, I will give you a ray of hope. In that I will discuss, I will unveil some of the important opportunities, and after that you should tell me, sir, opportunities are now available here. So if I do this work with all of you, I think I have succeeded in delivering my talk. So we will start from this scenario. Opportunities are not at all there. So we will turn this scenario into a new scenario, and that is opportunities are now here. So let us begin the opportunities. So we are having a cart. So cart is old cart which is having a old system wheel. So when I talk about a cart, it symbolizes our Ayurveda fraternity and their opportunities. If I see the wheel of a cart, if it is broken, if it is not round, if it is having any problem, then the cart will not move. Same thing is if I symbolize this wheel to a knowledge domain, so knowledge is the wheel of a cart. Then cart should move if it is embedded with all other things. It should be loaded, it should have two bullocks, it should have a rider. So a doctor is a rider over the cart, and the loaded articles are nothing but our skills. So to move a cart, we need knowledge, we need skill, we need a driver, we need a driving force, and last we need a communication skill. So we are having ample of opportunities, but to get these opportunities, we should have these 5 things. The 5 things are nothing but knowledge, skill, attitude, communication, and our leadership quality. So we have to develop all those things. Then only we can say our doctors are a packaged one who can be a one for all those opportunities. Because what the present scenario says that we are having knowledge, we are having lack of skill. We don't know how to develop our skill. So we are having opportunity to show our knowledge, but our skill is lacking, our attitude is lacking. So that's why, because I have shown this in a picture, but I will share you these things in my PPT. So if PPT would have been there, it would have been a nice thing to release this PPT, but don't worry, I will talk without PPT also. So our expectations are high. Always we say government has not done anything for us, government is not giving sufficient opportunity for us. No, this is not the scenario. If I tell you something, because from 2006 NRHM has come. Under NRHM, 44,000 NRHM doctors are working all over the country in PSCs. Then in 2011, the government of India started one more scheme. It is called as Rashtriya Bala Suraksha Karyakram, in which there are more than about 24,000 people are working. That's why in 2006 we had only 170 colleges. Now the college strength is increased to 410. That means government has given us ample opportunity, but we have not utilized it 100%. Why I am telling is that because if I give you an example of Karnataka, where there are more than about 3,600 PSCs are there, and government has given us a policy framework where they said in all PSCs there should be one Ayush doctor. But what is the scenario now? Because in 2006, 640 Ayush doctors have been recruited. After that, nobody has talked about recruiting Ayush doctors in other PSCs. Why? Because we have not shown them the result. We have started in Karnataka 12, because there I have said every year 3,000 PG scholars are coming. So what to do? We have thought of, when I was National Rural Health Mission State Program Officer, we have developed one scheme of developing specialty hospital. In Karnataka we are having about 30 districts, out of which 12 districts are having Panchakarma specialty hospitals. So we have done that, but the results are not encouraging because our own people have not worked in a positive way. They have worked. I am not criticizing any of them, but they have worked. But we have to show some of the results, because if we show the results, we would have asked all 30 districts. In India, we are having more than about 800 districts. In each district, if we develop one Panchakarma hospital, so 1,600 people of Panchakarma PGs will get a recruitment. Government has shown us these schemes. We are having in Government of India a scheme which is called Development of Specialty Hospital. We could have developed Panchakarma Hospital, we could have developed Ksharasutra Hospital, we could have developed the Shalakya Hospital, just like in line of Sridhariyam. So we are having this scheme, but the problem is that when we are implementing the things, our own people, our own doctors, they are not giving us support in terms of the outcome analysis. When we do the outcome, because government will ask us, so we will give you the fund, we will give you the infrastructure, we will give you the additional amount for medicine and all those things, and they will give HR. But what happens is, if we don't show the results in a positive way, then all these schemes will not be viable, and government will think that, okay, we have done so much thing for Ayush and we are not getting the viable outcomes. That is the problem. So that's why I said these 5 things are important for us. Knowledge, the second one is skill, third one is our attitude, fourth one is our communication, fifth one is our leadership quality. Because of lack of these 5 things, but I am not blaming that our knowledge is less, our knowledge is very good, but all other 4 things which cannot be attributed to academic things, you have to learn from outside the society. Leadership quality, any government Ayurvedic college will not tell you how to do the leadership. You have to learn from your thing. Skill, knowledge can be learned from a college, but skill should be developed by your own. So our expectation from the government is more, but government has also given us ample opportunity, but we have failed, because even including me, because I am not telling without me, including me, we have failed to encash that opportunities. So expectation of the government, there is a well-designed Ayush policy. In 1996, the government has given us separate directorate. In 2014, they have given us separate ministry and all those things, and even under 10th Finance Commission, they have given more than about 6,000 crores for Ayush. So that's a huge fund. When we talk about the funds are available. So now I have discussed about expectation from the government. The door is closed because we have to show them the outcome. If we show the outcome, we can open the door. This is the thing. The other one, expectation from us, from the society. We have to show the society. First, change our attitude. The second one, we are emotionally connected to Ayurveda, but it is fine. I don't have any problem that connecting emotionally to Ayurveda is fine. But we have to connect scientifically to Ayurveda. When we show scientifically, because emotional is one part, when we show the result in a scientific manner, the society will definitely say, oh, you have done a very good job. So this thing should be there. So we have to change our emotional behavior to scientific behavior. Then we have to develop entrepreneurship skills, and we have to develop our applied skills. This is important for us. So to finish my concept of status of Ayurveda, so there are expectation from government, there are expectation from us too. So we have to fulfill. What are the expectations from the government? What are the expectations from us? So I think our graduates will definitely meet the expectations. When we meet the expectation from government, when we get expectation from us, we have a right edge, right time and right thing to do the things. Okay, so I will start my lecture. So there are few questions are there. I searched in the internet where they said in Europe and USA, medical graduates are learning with their graduation the management skill. It is there in their curriculum. So it is a dual degree where they will learn Ayurveda and they will learn the management skill. Why? Because we are clinical person, or we can go to some pharmacy or anything, but why management is needed for us? That is the thing which is lacking with us, because we don't have a leadership quality, we don't have the management policies. So I think Akhila Bharata Vidyarthi Parishad is one of the places where you can develop your leadership. And ABVP, because I am also a student volunteer, student leader of ABVP, I learned many leadership skills, many management skills because of ABVP thoughts, AKVP actions. So congratulations to this great institution where thousands of our volunteers become successful Ayurvedic doctors because of Akhila Bharata Vidyarthi Parishad. On this platform, I wanted to congratulate Vineet and team for doing such a human work for our Ayurvedic graduates. I think the future of our Ayurvedic graduates really will be brightened because of the interventions, because of the actions of Akhila Bharati Vidyarthi Parishad. So this is also one of the things I wanted to share. The other one, because there is a paradigm shift from institutionalized health policy. So Government of India is thinking in terms of insurance-based, unveiled their plan in the form of Ayushman Bharat, where every individual citizen is insured for 5 lakhs, and it is a great opportunity for us because in coming days, many private hospitals, multinational hospitals are coming up, and now Government of India and Niti Ayoga is decided to include Ayush intervention under Ayushman Bharat insurance scheme. They are giving 5 lakhs. Now they are thinking about providing at least 1/3 of that amount for Ayush sector. That means if you can give the treatment of Ayurveda under Ayushman Bharat up to 1.5 lakhs. So you just multiply 1.5 lakhs into 130 crore population. It's a huge amount and it's a huge opportunity for a private sector. I think in future if this amount comes to our Ayush sector, nobody will come to government jobs, because 150, you just multiply 130 crore into 1.5 lakhs. So it is 130 into 1.5, that comes around, it is more than half of our Karnataka budget. That much of amount is there, but to get this, we have to get more and more skills. You see, I can tell you some of the insurance-based hospital institutions. We are having Apollo hospitals, we are having Narayana Hridayalaya, we are having, for ophthalmic care, we are having Agrawal Sai Hospital. Most of the hospitals are based on institutional-based and also insurance-based. So there will be a paradigm shift from next 5 years, so that when the insurance sector becomes the reality of health sector, then all of us will get definitely opportunity. So to get this opportunity, we should have a quality of entrepreneur, because we should develop our own institution. We are having a handful of institutions like Kottakkal Ayurveda Shala, we are having Sridhariyam, we are having Yashvyasa for yoga, we are having STM institutions, we are having KLE Belgaum like institution. But we have to develop at least 1,000 to 1,500, because we are having in Karnataka, I will only talk Karnataka because I am from Karnataka, we are having 30 districts, we are having more than about 225 taluks, we are having more than about 800 hoblis. Each and every hobli should have at least 2 to 3 private hospitals to cater the needs of Ayushman Bharat patients. I have told the amount is 1,50,000 multiplied by for Karnataka 6 crores, for India 1.5 lakhs multiplied by 130 crores. So think about India, there are about 860 districts are there, and in each, if I say in each district there are minimum of 5 taluks, you will have more than about 4,700 taluks, and there are more than about 26,000 hoblis. So please multiply each hobli with the 3 hospitals, each taluk with 4 hospitals, each district with 10 hospitals. We need at least 1,45,000 hospitals within 10 years. And you don't worry for the patients, because the money is there from Ayushman Bharat. Okay, so this is the opportunity from government sector. So we'll talk about these things in detail. So now, many of you have finished your BMS. Some of them are in second year, some of them are in first year. First of all, you should plan for your future. You should have 2 plans, one plan A and other one is plan B. Okay, before identifying your plan, first do SWOT analysis on your personality. SWOT analysis is strength, weakness, opportunity, threat. Please analyze yourself first. If you are a very good counselor, so you can ask me a question, how can I say I am a good counselor? You go to your talk with your friends, and some of them will say, okay, you are a good talker, or your conversation is very good, you reach my heart by your talk. So that means you are a counselor. Okay, suppose all of your friends are asking for your suggestion, and they say, okay, we have to do in your leadership, you have to lead us. Then you think that you are a leader. Suppose if you go to the wards and you communicate with the patient, the next day nurse will tell you, so that patient has asked about you, and that patient asked me, who is that doctor? That means you are a good doctor. So analyze yourself, introspect yourself in terms of whether are you a manager, are you a leader, are you a counselor, are you a doctor, are you an entrepreneur? Then, which is my plan A, which is my plan B. If you are, because if there is a mismatch in your behavior, in your thought, in your action, in your knowledge, in your skill, then after 10 years of your service or after 10 years of your occupation, you will feel bored because this is not my area. So you will say, because I have seen many doctors, my own classmates, they have practiced for 10 to 15 years. After that, somebody told, no, this is not my area, Shenoy. I wanted to go for a business, and they have started outlets of Patanjali, they have started outlet of Kottakkal, and they are they are coming out with great glory. That means they have not identified. So if years, now they are coming out with the glory. What's the problem? The problem is that they have shifted from one profession to other profession. They have taken a great risk. So this is a lesson for us. Don't take a risk. So analyze yourself first before going for an opportunity. Because I will give you hundreds of examples. One of my students, he was not at all interested in academics, and he used to do chit-chats in my classes. One day I asked him, what's the problem? He said, no, I am not interested in Ayurveda. I wanted to go for something else. Then I counseled him, and today he is a KS officer in Government of Karnataka in the cadre of Assistant Commissioner. I told him, this is not your area. You are born to be a administrator. So go for the administrative work. Now he is I can tell his name also, but this is not a platform to tell his name, because it is if you call me, I will tell his name. So don't worry. So see how we have to develop. And one of my friend was there. So he was not at all interested in business. So he was a gold medal student in our college. And he was a great Ayurvedic enthusiast, and he's having a business mood. So he has he started a pharmacy. Now his turnover is more than about 450 crores. I can name him because he is my friend, he is my classmate, and he is no one else. He is Rishikesh Damle of Atrimed, and his turnover per year is more than 300 crores. Last year he got the best businessman award. So because why I am telling these names is because these people have identified themselves in the student life, and now they are flourishing, and now they are ambassador of Ayurveda. So this person year from ITBT department, because there was a competition and he won the competition, and Government of India gave him 50 lakh rupees for his innovative work. Now he is working for COVID also. So you see how we have to develop ourselves, because what we are doing, we will blame society, we will blame population, we will blame our parents, we will blame our college, and we are not introspecting ourselves. What is our strength? From today onwards, you please dedicate at least 5 minutes per day to dedicate yourself. Just see what is your strength. Take a book, write down, these are my strengths. Then plan according to your strength. Then just 1 minute you spare for yourself, because you have to write down your weakness also. Because whenever the strength is there, the mirror of the strength is the weakness. So that's why to enlist the strength we need 5 minutes. To enlist the weakness we need 1 minute. If I give 5 minutes, you may need hundreds of books. So I just wanted weakness should be limited to 1 page. Okay, why we have to do this exercise? Because if you go on analyzing your weakness, you will get only fears. You will only get the threats, and threat will deter you from doing some entrepreneurship work. When you analyze yourself in the mirror of strength, you will get the opportunity. I will give you an example. One of my junior was there. So his habit is that he used to come to the college once in a full moon day. So all our teachers used to tell, no, don't, because he is a guest for our college. And his hobby was, he used to come to our college, and our college is very near to Mysore city. He used to roam around all the restaurants. And he used to tell me, so Shenoy, see, you have to go there, you have to eat this masala dosa. You have to go there, you have to eat this sambar. You have to go there, you have to eat this chutney. Okay, I said, why you came for this Ayurveda? You should have been a hotelier. You should have opened a restaurant. Why you have done this? No. I will apply my Ayurveda knowledge in my career. So I said, it is not possible. You are every day, you are not coming to the college. You are not attending the classes. And still you are telling that I will apply my knowledge of Ayurveda in my business. Today he has started one Ayurvedic restaurant. Do you know what is the rate for the dinner? The rate is 1,600 rupees plus 28% tax. The hotel is there in Koormangal. So you can visit there. So the interesting thing here is that even to get a table in that restaurant, for me also, I have to apply online. Today if I try to apply online, I will get my ticket or my turn after 25 days. And now his turnover per year is more than 5 crores, and I am doing government work here. You see how the difference. This thing for you is that you should have enlist your strengths, you should enlist your weaknesses, and try to work on your strength and develop a plan in the student life itself. And it is not possible after graduation, because after graduation, if you go to your village, your father, mommy, daddy will tell that, okay, now you have finished your graduation course, you should marry now. So they will search a bride for you or a bridegroom for you. And the whole thing of planning will go there itself. So don't go for this. So in the student life only, you have to develop your plan. When you develop a plan, there are two options are there. You can get a chance. You can get a chance to implement your plan. There is also a possibility is there. One of my friend has got a chance to implement his plan with a multi-millionaire, and now he is doing a very good human service in Mysore only. He has started one wellness center. It is because of a chance, because the Maharshi people asked him to go to Russia, and after going to Russia, he developed some contacts. From Russia, he came back to Mysore. From the same Russian people, they asked him to do a wellness center in Madikeri. Now he is flourishing with a wellness center. You see, when you are having a plan, there is a chance for you. I have given this example. And when you are having a plan, there is a change for you, because you have to wait for a change. So chance and change, both are important, because chance is CHANCE, change is CHANGE. So you have to only change G to C. That's all. So when you change G to C, God will be there to see you. That's the thing. So please remember, when you are having a plan, there are two things are there. One is chance, one is change. For both of the things, if you are really work hard, you will definitely succeed here. So this is only, I am talking about some of the concepts here. Now I will go to directly what are the opportunities, because at the end of my lecture, Shenoy sir has not told anything. He has given just like Ayurveda Sutrasthana, all the things, and nothing like Chikitsasthana. So up to now, the thing is Sutrasthana. So now we will go to Chikitsa Sthana, where I will give you some of the important hints. Okay, some of you may ask me, is there is any future for Ayurveda? I can give you thousands of examples. I can give one example. In 2012, under FMCG, fast moving consumer goods, Hindustan Liver was the pioneer, which has got the market share of more than about 40,000 crores in FMCG sector. In 2019, their market share fall down to merely 24,000 crores because of one intervention of Ramdev Baba, that is Patanjali. Now they are having more than about 1,600 consumable goods, including soap, including all your FMCG items, and they have given a tough competition for a multi-billion company, that is Hindustan Liver. And because of that, now you are seeing Vedic paste from Hindustan Liver, Colgate salt paste from Hindustan Liver. You see what is the impact of a one person. So because of Patanjali, Patanjali is basically Ayurveda. So he has given a tough competition to Hindustan Liver, and he has marketed up to 40,000 crores from 2014 to 2018. Now because of some stiff competition from other companies, now the market share is decreased. Still, if it is at the level of 25,000 crores, it's a great impact on our economy, and it is a great impact for Ayurveda also. The other one I will tell you, the one which is very, very important for us. 100 years back, if I go to the story of Kottakkal Ayurveda Shala. The Kottakkal Ayurveda Shala is one of the pioneer entrepreneurship in Ayurveda, where they have started from a single dispensing unit. Now they are having more than about 12,000 outlets across India and more than 150 outlets in foreign countries. And because they are pioneers in this, that's why I just wanted to name them also, because they are the first entrepreneurs in Ayurveda. So my salutation to Warrior sir, and his grandson is now turning 100 years, so Krishna Warrior. So my salutation to him also, and he has done a great job for us. My salutation to other entrepreneurs of Ayurveda. If I miss the name of Nambudari sir, that is Sridhari M, it is not fair on my part, because he has developed one village into a tourist hub. The Kotatikulam is a small village in Kerala. Now it is a tourist hub. More than about there is a 800 bedded hospital only for Shalakya. It's a great thing, entrepreneurship skill. So you see, because I am giving the examples of these pioneers who have given us a satisfaction on entrepreneurship. And one more is that is Neelakantan Bose of Vaidyaratnam, because he is also an entrepreneur. So one more, if I miss Guruji's name, it is not a good thing for me, because Ravi Shankar Guruji, he has started Sri Sri Ayurveda products, and now it is globally accepted. There are more than about 350 products are there, and they are running the product in a very good modern style, and now they are also one of the entrepreneurs in Ayurveda. Then I can tell you the name of Maharshi. I can tell you the name of Trigunaji, because he has developed the Nadi Vijnan for us, and it's a great opportunity for us to learn Nadi Vijnan from him, and we can design this Nadi Vijnan to a greater height, provided we have to be scientifically analyze these things, and we have to scientifically give the data to all the population, and Nadi Vigyan is one of the important opportunities of growth for us. And if I don't tell the name of B.K. Sayengar, he is pioneer of yoga and he has spread Ayurveda and yoga equally. So my salutation to B.K. Sayengar also, because why I am telling all those names are, they are the entrepreneurs for us, and they are our forefathers, and they are our great achievers of Ayurveda. And if I tell with their name, I think I have justified my topic, because I have to look back. Just like a lion look back his journey, I have to look back the journey of Ayurveda people who have excelled in their business, who have excelled in their career, who have excelled in their entrepreneurs, and they are real heroes of Ayurveda, and I can tell you that they are real heroes of Ayurveda, and that's why many of them got Padma Vibhushana, many of them got Padma Bhushana, and the government of India has rightly given their deserved titles. So in my lecture, because I am giving the lectures to our own future ambassadors of Ayurveda, because I just wanted to open your eyes that we are having heroes with us, so we should remember them, and after remembering them we should have our plan. Then I think definitely, because one shloka is there in Ashtanga Sangraha Ayurveda Upadesheshu Videyaha Paramadaraha. So if we wanted to design our plan, we have to remember all our ancestors, not only from Charakacharya. We have to talk about the real heroes of nowadays. We are having many real heroes, so we have to name them also. All these names are there in my PPT. I will share my PPT. So this is important for you, because after seeing them you will get an idea that we too try in this field, and we will excel our science and ourselves by doing a great human service to the society. Okay, so I have given many names in front of you, and I think in future, if I get an opportunity after 50 years, I think some of your name I can quote if I am alive. I think God bless you to quote your name in my future series in these lines. So I think some of you may get this chance after 10 or 15 years. So I can tell proudly that I have given them on that day, and today I am quoting them as an example for future generation. So I pray God Dhanvantari to give us an opportunity after 10 or 15 years to name few of you in this category. So to summarize my topic, so first of all, we should have a passion to learn. We should have a practical knowledge. We should have an idea how to plan. We should have a logical thinking skill. We should have analytical thinking skill. And if all these are there, we can identify our opportunity. So with all these arms and ammunitions, you can be an entrepreneur in Ayurveda. Without these arms and ammunitions, it is not possible just by a knowledge. So I think all of you are a born entrepreneurs. My congratulations to you. But what you have to do is that plan your future first. Then you have developed the skill according to your plan. So the prerequisite to grab the opportunities are, first, your undergraduate degree. So already you have stepped in. Some of you may have finished. Some of you may have come to the end. Some of you may have started your academics. So be fair in your academics. Then if you get an opportunity, do a post-graduation. After these two things, you should work with some of the great Ayurvedic doctors to get a working experience. Then if time permits, exposed to the management also. You should develop some management skills. So the prerequisites for opportunity: first knowledge, the second skill, third is attitude. So these three things will definitely fetch you to go for all the opportunities. So I will end my talk with a few of the inputs. I have told that I will give you some inputs. So suppose you are a graduate in Ayurveda. What are the opportunities available for you? One, you can, because that is the simple and straight opportunity for you. One, you can do the clinical practice. Okay. Sir, it is not possible for me to do a clinical practice. Okay, you can go for further studies, that is PG fellowship in Ayurveda, and you can go for a PhD. So, sir, it is not possible for me because I am having some financial problem, or you can say, no, I have to devote myself to my family. It is not possible for to do the PG studies. Okay, there is a opportunity for you in a pharmaceutical line. In Karnataka, we are having more than about 225 pharmaceutical units, out of which 25 are the big units like Himalaya. We are having Kottakkal Ayurveda Shala in Nanjangud. So big units are there, 25. The medium units are there. There are about 104 medium units are there, and small units are there. So then you can try for government jobs. Then other opportunities are there. I will talk about these things. Then there is an opportunity in research. There are other opportunities in agriculture, in biotechnology, in forestry. So for a PG student, the opportunities are like this. So you can be an academician, you can start a clinic, you can start a hospital, you can go for a research, you can go for a pharmacy, you can start your own pharmacy, or there is one more opportunity is available for you, because Government of India has come out with the plan of developing the specialty hospitals, where they will, you people will get a beautiful recruitment in taluk hospitals and district hospitals. Government of India has come out with a beautiful plan. That plan is called as Ayush Health Mission. It is developed in 2012, 6 years after its inception. So it is an important form of facility for us, Ayush Health Mission. So it is a joint venture from central government and state government. So central government ratio is 60 to 40%. So share of central government is 60% and share of state government is 40%. Every year state should give a plan to the center, and center will give you a kitty of money. So they will say, this year Karnataka will get 30 crores. Please plan for 30 crores. If Karnataka gets 30 crores, Government of India will give 18 crores and Karnataka government will give 12 crores. The planning is from the state. So where you can expedite this amount, you can get manpower, you can get infrastructure, you can develop your hospitals, you can develop your dispensaries, you can develop your colleges, you can develop your pharmacy, you can develop your research center. So there are many programs are there in government. So the important facilities available in Ayush Health Mission is, one is integrated, you can develop integrated Ayush hospital in district hospital, 50-bedded integrated hospital. So you see there are 856 districts in India. So if each district gets one hospital of integrated, where 856 into each hospital will get 5 posts, that means 4,000 people will get job. This scheme is available in the government sector, central government. State government should give its accent to develop this institution. 60% of the money will be given by the center and 40% of the money should be given from the state. So our doctors, our post-graduation doctors will get a beautiful opportunity here. Then, if you wanted to develop your taluk hospitals, there is a scheme in National Ayush Mission where the National Ayush Mission will give 8 manpowers, 2 doctors, 2 pharmacists, 2 doctors, 2 staff nurse, 1 multi-purpose worker and 2 massages and 1 pharmacist. So 8 people can be recruited there, but the state government and central government should give a plan for that. You see, many of such facilities are available under National Ayush Mission. You can develop a medicinal plant garden under National Ayush Mission. You can develop your college. You can develop your pharmacy. You can upgrade your pharmacy. You can upgrade your research center. And planning should go from the state. Planning should grow from our own Ayurveda people. I think AKVP is one of the platform where it can design these policies and pressurize the government to get consent, accent for all these schemes. These schemes are already available. So I just wanted to give you a glimpse of this. There are many schemes are available under National Ayush Mission. When I talk about one more important scheme is there, it is unveiled by our Honorable Prime Minister Narendra Modi in 2018. That scheme is called as Ayushman Bharat. And in the scheme, at the inception itself, they have told that 1,50,000 wellness center will be rolled out to the public within 2021. That means within 2 years, you will get 1.5 lakhs wellness center set up all over India, and each wellness center will be supported by an Ayurveda doctor, and all of us will get an opportunity to apply there. If the age limit is between 24 and 38, I am sure that there are not more than 1.5 lakh graduates are present in India. So to take this opportunity, so let us hope for the best. Under Ayushman Bharat, there are 1,50,000 opportunities are there. But I will tell you here itself, because these opportunities can be grabbed by the nursing faculty, the pharmacy faculty, because the government of India has clearly told that we need a rural doctor. So now we have to fight it out, because 10% of the things are already reserved for Ayush. So 50,000 posts are already given to us. So if we plan for the higher posts, we have to fight it out with the higher authorities, and we can avail this also. Because if each and every wellness center is managed by an Ayush doctor, there are 1,50,000 opportunities are available, which are on hand under Ayushman Bharat. This is the first part of Ayushman Bharat. The second part of the Ayushman Bharat, it is already rolled, where each citizen will get a health insurance of 5 lakhs rupees. It is insurance-based scheme, and Government of India has written to the Niti Ayoga whether can we give some of this kitty to Ayush. They have given a positive response for us. So 1/3 of the money can be given as a policy matter to us. That means a huge money is there for us, and we have to develop ourselves, because we have to set up our clinics, we have to set up our Ayush hospitals, we have to set up our multi-speciality hospital Ayush and all such, because we are having only clinics now. In Ayushman Bharat, there is a scope to set up speciality hospitals. You can have a speciality private Panchakarma hospital. You can have specialty private colorectal hospitals. You can have specialty Prasutantra hospital. You can have specialty Shalakya hospital, because you need not worry for the patients, because Ayushman Bharat insurance scheme will recognize you and they will send you the patient, provided you are having a good skill in your specialty. That is the problem for us, because many of us are not having the good clinical skill to show the public, to show the population that we can do something in our specialty. So that's why I said we have to develop our skill. If we develop our skill, we will get this scheme, that is part 2 of the Ayushman Bharat insurance based skill, where I have told in the beginning of my talk, the amount is 1.5 lakhs multiplied by 130 crores. That is the thing. So please multiply it and see how many zeros are there, and tell me now itself 150 multiplied by 300 crore means this much of zero. Okay, so best of luck. So I have told about Ayushman Bharat, the impact of Ayushman Bharat. So I wanted to tell you the impact of Ayushman Bharat. If Government of India and state government concurrently decide that each wellness center is managed by an Ayush doctor, 1.5 lakh our people will get a direct job within 2 years. One thing. Then there is an indirect opportunity. If it is an insurance sector, we need doctors who can manage the insurance companies, because insurance company wanted to analyze all the cases. For that they need doctors. The MBBS doctors will not come to see the data of the insurance company. Now the choice remained is only BDS or Ayush people have to go there. I think there are 876 districts in India. Each district needs 2 Ayush doctors as insurance officer. That means 876 into 2 means it is more than 1,700. There are more than about 4,700 taluks. Each taluk needs 1 Ayush doctor. That means 4,700 doctors will get the job. You see, I have told 1.5 lakhs plus 4,700 plus 1,600, that becomes more than about 1,70,000 opportunities are there within 2 years in government sector, provided our platform pressurizes the government to manage the wellness center under Ayush only. So there is a rider is there, because Government of India has given 10% of these wellness centers will be managed by Ayush, others will be managed by some other people. Now we are having an opportunity. We have to take these 10% of the centers and we have to manage first. We have to show the results. Then definitely Government of India will ask us to manage these things. Then there was a scheme under LRHM. It was incepted in 2006, where they have given a clear-cut plan saying that 1/3 of the total primary health centers are managed by Ayurveda doctors. This was the statement given in 2006. In Karnataka, we are having 4,000 odd PSCs. We are having 8,000 odd A&M centers. You see, in India there are more than about 64,000 primary health centers are there. So if according to their plan, if 1/3 of these primary health centers are filled by Ayush people, I think more than about 64,000 means more than about 24,000 of us will get a job opportunity. But what happened is, the scheme started in 2006. Our own people joined there, and Government of India is not seeing any improvement under this scheme, and they are now not recruiting our people for further extension. So this should not happen. So we have to develop ourselves so that we can also get this opportunity. And Government of India has come with a novel scheme that is named as RBSK, that is called Rashtriya Bala Suraksha Karyakram. It was started in 2011-12 and the recruitment is started in 2013. In Karnataka we are having more than about 1,400 Ayush doctors working under RBSK. So each taluka, there are 4 doctors are there. So if this scheme is continued in Hubli, I think another 5,000 doctors may get a chance to work under RBSK also. This is also an important opportunity for us. We have to try. I think ABP platform will try for this so that our graduates will get more and more opportunities here. Then Government of India is planning to establish some government urban Ayush facilities, that is in lines of wellness center. I think more than about 2,000 doctors will get recruitment here if the planning comes in time. See, these are the at the level of planning. So I have told this because I have given this in my slide also. I will share my slide here. There is one more scheme, it is called as National Urban Health Mission. This is called as NUHM. So it is catering the primary health care facilities to the urban people. So now Government of India is thinking in terms of starting wellness centers under NUHM in urban areas also. So I think if there are more than about 800 to 900 urban centers are there, so if each center will get one doctor means there are opportunities for 800 doctors. So these are there. So suppose I have told all the opportunities in government sector in future. Suppose if you say, sir, because of some reason I have not got any opportunity in government sector, don't worry. There is one more scheme is available. It is not under government. It is not under government. It is Rashtriya Ayurveda, RAV, Rashtriya Ayurveda Parishad, that is RAV. It is a novel institution where Gurukula Paddhati is established. Every year they will call the graduates for an exam. The exams will be conducted every year in the month of June or July. So you have to appear for the exam, and after passing this exam, they will give you an opportunity to learn and train under important Vaidyas all over the country. And they will give you a remuneration of 25,000 for 1 year, and at the end of the 1 year you have to subject a project. And after submitting project, you will get a degree, say that you are a fellow of RAV. This is a paid degree, so you will be given an opportunity to earn and learn. So our graduates can go for this. So RAV exams are there. So important thing here is, it is a learning and training Gurukula Paddhati institution, where you can also earn, you can earn your money, you can learn the knowledge, you can update your skill also. But before writing exam, the first and foremost thing for you is that you have to select your speciality. This is a speciality skilled course. That is called fellowship in RAV. So here you can do this one. Then some of your fellows doesn't know how to prepare the medicine. If you are very good in preparation of medicine, you can also start a small dispensary with the preparation, and you can also earn money by dispensing the medicine to your fellow graduates. And this scheme is available in Jharkhand, where some of our doctors, they prepare the medicines and sell to and dispense it to their fellow doctors only. So this is also there. Or you can start your Panchakarma theatre, because I have seen in many Kerala, even Aleppi and Mulnar and footings of Mulnar, many wellness center with simple equipped Panchakarma theatres, and they are giving beautiful service, the fantastic service, curative, promotive, preventive. Because you don't think only in terms of curative, you can go for preventive, you can go for promotive, you can go for preventive skills, promotive skills and clinical skills. Start a Panchakarma highly specialized hospital with highly specialized theatre and all those things. And this practice is there. I have seen this practice in Kerala, Aleppi, Mulnar and all those things, where wellness centers in the name of Panchakarma centers are developed. You can design this center under a PPP mode also. So there are some certificate courses are there. You can go for that. There is a certificate course for Panchakarma in Manipal University, 1 year course. Suppose if you face to get an admission in MD for Ayurveda, you can go for such courses where PG certificate course is available in Manipal, 1 year course, 6 months course, and for that you have to pay some money. And if you say, sir, I don't have money for that, can I get free courses? You are having free courses. There is one center that is Ayurveda Hospital in Chirutirthi, that is in Kerala. It is a central government institution. Every year they are giving 1 month, 3 months, 15 days trainings to our Ayurvedic graduates in Panchakarma, in Kshara Sutra. So you can go because it is a Government of India initiative where they will not charge. They will give you the food, the accommodation and knowledge. Then there are some diploma courses are there. So you can go for the diploma courses. These are available in Hassan, the SDM Hassan. It is available in Pune. So you can go for that. Then there are some practitioners are there. So there is one institution, Ollur Vaidyaratnam College, Vaidyaratnam institution, that is the institution near Thrissur, where periodical training in Panchakarma is given. So you can approach them, Thrissur, Vaidyaratnam. They are giving periodic training on Panchakarma. So these things I am telling why, because some of you may miss the PG seats. Don't worry, Panchakarma trainings are also available in government sector. Panchakarma trainings are also available in private sector. So I am giving both of these things. So there is one dentistry course is there, Ayurveda dentistry, that is Danta Visharada, that is in Rajkot, Jalram Bappa Ayurvedic College. So you can also go for that. Then you can train and learn the skills of Shalakya from Sridhari Maya Hospital, that is near Cochin. So you can go because this is also one of the beautiful hospital. You can also learn under Vaidya Balendra Prakash Dehradun because he is specialized in oncology, because he is also giving training for our graduates, 1 month, 2 month, 3 month courses. Then suppose if you are interested in Ayurvedic cosmetics, there is a certified course in Pune, that is certificate course for in Ayurvedic cosmetics, beauty, skin care and hair care. So you can go and get the degree fellowship from these courses. There are such courses are available. After finishing your undergraduate course, you can go for such courses and get the technical skills under a master. That's also important for you. So this is the thing. So there are some of the courses are available under Indira Gandhi National Open University, Annamalai University for in food and nutrition. There is one more course is available in Yeshwasa University. After finishing your Ayurveda undergraduate, you can do MSc in yoga, diploma in yoga, certificate course in yoga. You can also do the PhD in yoga. It's available. 2 years course for PhD, MSc. Even in Annamalai University, 1 year course is available for our Ayurvedic graduates for yoga, because yoga is nowadays is fashion in foreign countries. So along with the Ayurveda, if you are having a yoga degree, it's a great honor for you, because they treat, because this person knows Ayurveda, this person knows yoga. But you need a specialized certificate course. You can apply these courses in Yeshwasa, even in Annamalai University, even Karnataka State Open University is coming out with beautiful 1-year course in yoga from next year. So you can apply, and in Annamalai the course cost you less than 15,000 rupees. In Karnataka State Open University, the course cost you less than 10,000 rupees. And in Yashvasa, the course cost you less than 25,000 rupees. So don't worry about it. You can go for here. You can learn and earn your thing. So enhancement of the skill, you can do this one. Then some of the Agata Tantra courses are there. There are some of the traditional Vishwavidyas are there. So under them you can train. In Kannur, Kerala, there is one Vishwavidya. So you can go and learn the art of Vishachikitsa from there. So there is a certified sports medicine course for Ayurvedic graduates in Pune University, and there is PGDHS course in Annamalai University, and you can also apply for the food and nutrition course in Annamalai University. That is a 2 years course. You can apply for diploma in public health. You can apply for graduate course in public health in Annamalai University. It costs you less than 20,000 rupees. It is a 2 years course. So after finishing this course, what opportunity you are getting in National Health Mission? There are some program officers posts are there for which the public health is a mandatory course. After your doctoral degree, that is BAMS, BHMS, BAMS or BOMS or BNMS or MBBS, after that if you have a public health degree, they will recruit you as the program officer under NRHM, under NUHM, even in Kerala, even in Karnataka, Tamil Nadu, in all states. In a state program unit, there is a scope for this. So you can go for these courses. There is a PG diploma course is available in IGNO, Indira Gandhi National Open University, in geriatrics. There is a course in Annamalai University also on geriatrics. So you can also go for these courses. There is a Marma Therapy Center in Kerala under Sports Authority of India, where they will train our graduates on Marma therapy. So you can also consult the Sai Hospital, that is Sports Authority of India Hospital in Kerala. So where you can learn the Marma therapy and you can develop the skill and start your clinic. And then MD, MS courses are available. All subjects there are available. There is one more course is there, BSc and MSc Yoga in Annamalai University. It will cost you less than 25,000 for you. There is one course for you if you are interested in Manasa Yoga, that is MSc in Mental Health and Counseling. So many of my students have approached there, they have completed their course, and they are now practicing as counselors and they are earning their money, and they are practicing Ayurveda along with counseling. So you can also go for this course. This is MSc in Mental Health and Counseling under Coimbatore University, and NIMMANS, the National Institute of Medical and Health Science, have also thinking of having a mental health course for Ayurveda. So in next year or within 2021 or 22, definitely you people will get an opportunity to learn under the prestigious National Institute NIMMANS, and mental health course for Ayurveda will start there, and you can get the degree from there. And here the important thing is that it is a government initiative, and you please go there and learn the skill of mental health from them. Then there is one more course in Jamnagar, MSc in Medicinal Plant. This is one of the important course because Government of India last week announced a beautiful scheme of 6,000 crores. This is COVID package scheme unveiled by our Honorable Prime Minister Narendra Modi ji. They wanted to develop a medicinal plant corridor under Ganga Basin. So 6,000 crore amount is reserved for that. I think in future, whoever has done Dravya Guna, whoever has done MSc medicinal plant, they will definitely get a job in government under this scheme. Because 6,000 crore rupees has been assigned for this, and the whole Ganga basin, it starts from Himalayas and in West Bengal. It is more than about 1,800 kilometers. The whole Ganga basin will be developed as medicinal plant corridor, and all of us will get an opportunity to work for medicinal plant because it is a need of hour. And some of our graduates may think about to shift their knowledge, because there is one more course is there, MSc Anatomy, MSc Physiology, MSc Biochemistry in Manipal University, and it is a costly course because they will charge more than 4.5 lakhs for 2 years. And if you get a degree from MAHE, Manipal University, in anatomy and physiology, you will definitely get a job in medical college as anatomy tutor or physiology tutor or biochemistry tutor, and this is only available for Ayush fraternity because some of the seats are reserved for them, and I have seen many of our graduates are working there, and now they are working in medical colleges because in medical colleges there is dearth of staff in anatomy and physiology, and now they are recruiting MSc Anatomy, MSc Physiology fellows. But there is a small problem here. You have to invest more than about 4.5 lakhs, but don't go for the courses of anatomy physiology from other universities, because this anatomy physiology course in Manipal University is done under the Manipal Medical College, and the certificate is given from the Manipal Medical College, and the private medical colleges will recruit you if they get a degree certificate from medical college. That is important, so please go for that. And there is one more course is there in BHU, that is PG Diploma in Drug Standardization, because this course is very useful if you wanted to develop your own pharmacy. That course is there. There is one more course is there, that is PG certificate course in bioavailability, clinical trials and bioequivalence, and Government of India is planning to develop research centers. In 2018 they have recruited 100, first time in the history they have recruited 100 research officers. So they are developing their research institutions. This year they have called about 12 posts in research. Next year they also call, and if you are having a certificate course in clinical trials, this course is available in Pune, so you can try that one. And there is one more course, that is PG Diploma in Yoga Nature Cure, is available for Ayurvedic graduates, and there is a you will get some stipend also. It is there in Jamnagar, and this course is there in Mysore University, KSOU also, but there is no stipend for this one. Then Yoga Teachers Training course is available in Ishwasa. Then Yoga Diploma course is available in Ishwasa, so you can also go for these courses. Then there are specialized courses are there. It is not useful for Ayurveda, but if you wanted to shift your, because you as I said, after doing SWOT analysis, you say my skills are better in other areas. So then there is one more course is there in Annamalai University. It is called as PGDHSC in Public Health, PGDHSC in Hospital Management, PDGHSC in Reproductive and Sexual Medicine, PDHSC in Medical Legal Practice, then Adolescent Health and Education. These are the courses are available in Annamalai University. There is few more courses are there, PG Diploma courses in Maternal and Child Health, because these are the courses which will fetch you a job in NUHM and LRHM, because there are more and more job opportunities are there in RCH and MCH. So if you are having a medical degree along with maternal child health degree, so there are chances that you may get a chance work under NUHM and NHM. There is one more course is there, Diploma in Early Childhood Care and Education, IGNO, because getting a diploma degree from IGNO is very easy, because you have to send them some assignments, you have to go for some practical classes, then at the year end there will be an exam. Okay, exam is only for 70 marks and assignment is there for 30 marks. And the course fees is very, very little. For per paper, the course fees is more than about 2,500 to 3,000. For a diploma course, there are 6 subjects are there. So you may finish the course within 15,000. It's very, very important. Then there is one more chance for you. You can do a MBA in HR, hospital administration. You can do a MBA degree in finance. You can do a MBA degree in marketing. Because many of our pharmacies are lacking because of marketing effort. We don't have professionally marketed person. So there are in India we are having more than about 300 big pharmacy companies, and even it is a great gesture for us. Most of the MNCs, pharmacy companies, are coming out with Ayurvedic products. So when these Ayurvedic products are launched, our own graduates will get an opportunity to work as field officers, work as front officers in a pharmacy company. And if you are having a marketing degree, MBA, you will get that job. So MBA in HR, MBA in hospital management, MBA in finance, you can get this degree from IGNOU also. IGNOU is very cheaper. So within 80 to 90,000, within 3 years you can finish it off, and you need not go to the college. It is an online course and you can get this degree also. That is from the IGNOU. There are some of the courses are available. That is certified course in Rashtriya Ayurveda Vidyapita. I have told about this. There are about more than about 300 well-versed, practically oriented doctors. So you can work under them, and this is a great opportunity for you. Please write the exam of CRAV, that is certified Rashtriya Ayurveda Vidyapita fellow. So if you pass this exam, you will definitely get a opportunity to work under the pioneers of Ayurveda. This is also important. So there are more than. Then if you wanted to start a pharmaceutical company, because there is a great opportunity available there. If you wanted to, because in Karnataka, under the Karnataka industrial policy, there are many incentives are given to the pharmacy people. So pharmacy is also considered as in Karnataka a startup. For startup, they will give you a soft loan, they will give you a free land, they will give you a free electricity, they will give you free water supply, they will give you income tax rebate, they will give you tax holiday, they will give you subsidized rates, and they will give you also the insurance benefit. Suppose if you lost, it will be covered under the insurance. So startup is available for the pharmaceutical companies. So you can start the pharmaceutical company. Why I am telling it? Because one of my colleague who was working with government of Karnataka, he resigned immediately and started a company in 2010 with a small product called as ginger chat. Now his turnover is more than about 20 crores. He resigned his government job and started a startup in Bijapur. So now it is called as Ginger Chat. Now its turnover is more than about 10 crores. Why I am giving this example? This example will definitely give you a spirit of going for a business. Okay, in under pharmaceutical company, if you are not interested to start a company, don't worry. There are also opportunities are there to in marketing. There are opportunities are there for Draveguda students. There are opportunities for Rashastra students in drug development, and there are opportunities are there in the quality control, quality assurance also. So our graduates will definitely get some of the important posts under pharmaceutical company. And Government of India, the Niti Ayoga, has already given a vision for next 10 years, that within next 10 years the India needs more than about 300 to 400 big pharmaceutical company. If these 300 to 400 pharmaceutical company established in India, means our graduates will get more and more opportunity, and this opportunity will be only available for Draveguda Rashastra people or other graduates who are well versed in quality control, who are well versed in quality assurance. We are well versed in drug development and in marketing. There is one more opportunity for you. The opportunity is called as medical transcription. So it is also one of the opportunity, but now there are science graduates are going for the medical transcription. So you can also, there is a course in Bangalore for medical transcription, 6 months course, but here the important thing is you should be well versed in computers, and your computer knowledge will be tested here rather than your medical transcription knowledge. Then you can work as a JRF, because in Government of India there are more than about 25 national central institutes are there, research institute, and every year they are calling for JRF. You can be also a part of the project as a JRF. And some of them are calling for SRF also, Senior Research Fellow, so you can also apply for that. Other than this, you are having one more beautiful opportunity in Karnataka under Industry Department, because Industry Department consider wellness centers as the important industry. So you can start a wellness center, you can start a wellness center in star hotels, you can start a wellness center in clubs. For that you will get some of the important incentive from Government of India. It is not from Ayush Department, it is from the Industry Department. So you can get some of the things, and one more opportunity is there for you under Tourism Department under Government of Karnataka and many states, where you can establish the wellness center under tourism policy, where they will give you a land, where they will give you some of the subsidies, they will give you the soft loans, they will give you the income tax rebate, and all those things are available, one under Industry Department, one under Medical Tourism Department. So you can also go for these opportunities. So I have unveiled many opportunities for you, and there are other opportunities are there. There are even under research. Government of India will fund you. Under UGC you can also write a project. Government of India will fund you. Under CCRS there are many schemes are there for research, but you should know how to write a project. You should know how to present a project. You should know how to write a outcome oriented project. That is important. There are many schemes are available under CCRS. There are many schemes are available under Government of India, Department of Ayush. There are funding schemes are available under Rajiv Gandhi University in Karnataka. There are funding schemes are available under corporate social responsibility schemes, CSR schemes. So you can send some proposal or project proposal to such institution, and you can get the fund and do the project, and you can earn the money. So the postgraduate students can do this because they are having an idea how to write a project, because they have done already their dissertation, they have done their thesis. So you can learn and earn in research also. There are private funded projects are there. Homi Baba Fellowship is there if you are doing a research. There are Tata Scholarship Fellowships are there. There are Microsoft Fellowships are there. There are Fulbright Fellowships are there. So you can also go for this one. And lastly, I just wanted to finish my topic with the international scenario. Here there are Ayush chairs are available in Government of India. Government of India is planning to start some of the Ayush chairs. In UAE, Ayush is recognized. In Nepal, Ayush is recognized. In Bangladesh, Ayush is recognized. In Sri Lanka, Ayush is recognized. In Hungary, Ayush is recognized. In Mauritius, Ayush is recognized. There are about 36 countries where Ayush is recognized. And many of our doctors are married to the foreign bridegrooms. So don't worry, you can practice there also. So first you have to see whether the foreign government is recognized your degree or not. So there are Singapore, Malaysia, there is wide scope is there. Even in UK there is a wide scope. Middlesex University has developed one course for Ayurveda that is called BSc Honours in Ayurveda, that is there in Middlesex University. Even government of UK has developed, recognized this one. So there are many things are there. So to get this opportunity, The important things you should possess is today itself you prepare a CV. A beautiful CV you should prepare and explore yourselves. And if you are a UG student, marks are important for government jobs, so go for the marks. There are many scholarships are available, so go for the scholarships. Then I have seen the lack of this because our students are always WhatsApp fans. Our students are always the technology fans. So come out of the technology, try to share your experiences with your fellow students, then you will learn Ayurveda, earn Ayurveda, and you can say Ayurveda Amritanam. Because we have thought that, because our forefathers have told that Ayurveda Amritanam, today it is there. So, mantra for your success is prepare a CV if you wanted a job. Try to get as much as knowledge. Then, skill is important. Academic excellence is important. Communication skill is important. Then, if possible, under the great institution like AKVP, you can also get some administrative skills, some leadership skills, and that will fetch you definitely a better career, a logical career, a advantageous career. And I think under the great umbrella of AKVP, all of you are lucky, and Jijnasa is a platform for you to share your experience. It's a platform for you to learn Ayurveda from great pioneers. It's a platform for you to interact with pioneers. It's a platform for you to learn the intricacy of the knowledge. And I think Jijnasa is a beautiful platform for all of you to develop yourself and develop our science, great science. Then only the dream of our forefathers, and they have already declared Ayurveda Amritanam. So it is our turn to make that dream of Ayurveda Amritanam a reality. Before I finish my topic, please pardon me, please excuse me because of technological snag. I delayed my talk. Thank you, Vinit. Thank you, all AKVP students. Thank you, AKVP fans. I think great opportunities are there for you in future, and try to grab the opportunities. And definitely, Dharmatari will bless you. Dharmatari will give you the knowledge. Dharmatari will give you the skills. Dharmatari will give you the communication skills. Whatever the things needed. Thank you, one and all. If you are having any questions, please ask, or you can write it down so I can answer you. So thank you, Vinit. So over to you, Vinit. Thank you, one and all. So one more thing, I will share my PPT on AKVP page. So please see the PPT because I have not told many things. Many things are there in the my PPT. Please open this PPT, and if you are having any doubt, please ask the question here, or you can ask me or interact me in AKVP page, Jijnasa page. Thank you, one and all. Bye. For ಮುಗೀತು ಅಲ್ಲ ಅದು ಕ್ವಶನ್ ಕೇಳಬೇಕಲ್ಲ ಅಪ್ಲೋಡ್ ಮಾಡ್ತಿದ್ದಾರೆ ಬೇಕಾದ್ರೆ ಅಪ್ಲೋಡ್ ಮಾಡಿಬಿಡ ಬೇಕಾದ್ರೆ ಅಪ್ಲೋಡ್ ಮಾಡಿ ವಿಡಿಯೋ ಇಲ್ಲ ಆಗಿಲ್ಲ ಅಪ್ಲೋಡ್ ಮಾಡಿ ಸೊ ಹೇಳಿಬಿಡಿ ನಾವು ಅಪ್ಲೋಡ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ phone madam. Hello. Wanted to interact with me can interact. Any questions? Vinith? Okay. So Ganesh is asked one question, sir, there is a requirement of any special certificate to run a pharmacy? Okay. So there is no special requirement to run a pharmacy. There is no such courses are available. So up to now what you have to do is that each state has got one drug controller. So you have to get a certificate or a permission from drug controller. So first you have to go to the drug controller and show your, because there will be an application is available for you. So you have to apply for the drug controller. You have to tell, because if you are preparing only classical medicines, you did not give the research profile. If you are doing your own proprietary medicine, you have to give a research profile. There is no degree is available, and there is no degree is needed also. Any Ayurvedic graduate can run a pharmacy, but the problem is that you have to get permission from the drug department, Ayurveda drug department, which is available in Ayush department. So Venkat Dharmadhikari sir, thank you. So it's a small effort I have done. I have not done. I am not satisfied with my talk. So I think I have done some justice. Thank you for your appreciation. Narayan Jadhav sir, thank you. Shom Shekhar, thank you. So any question is there, you can ask. Okay, so many of thank you for all your valuable suggestions. So I will only ask, I will answer only the questions. So many of you have given me applause. Thank you very much. So if any questions are there, I will just justify. Okay, Ganesh, Prasad, okay, Venkatesh Nair, Nitin Patel, okay, Dharmesh, Savita Gaudar, Iranna. Okay, Akil, Varghese Joy, Pallavi, Lamse, okay. Okay, thank you, Manju, so because you said you are seeing some ray of hope. So I think I have done a very good time, because I think if you say that you have seen some ray of hope, means I have justified my talk. Thank you. Pharmacy, okay, Ganesh, thank you. So I will share my PPT, Govindji, definitely I will share my PPT. Okay, thank you Kailash for your beautiful words. So any questions, please ask. I am not seeing any questions, only applauses for me. Thank you. Any questions you can ask. And in my PPT, I have shown some of the opportunities in Karnataka government, some of the opportunities in Government of India, some of the opportunities in elsewhere. So all these things are there. So I will share my PPT here. So you can see the PPT, and after that you can comment on the PPT, no problem. And my special thanks to my PG students, Nivedita and Anusha Bunt, and my special thanks to other PG students who have developed my then two pharmacy students. They have given me the inputs, Sachidanand and the other one, Suraj also. So thank you one and all. So I am not seeing any questions. It's a great opportunity to talk in front of Mamata Bhagavat, the senior most Ayurveda faculty. Thank you, madam. I am seeing you are watching my program. Rajeshwari is also watching. Thank you. Because all of them are senior faculties. And my own students many of my own students are watching. Thank you. So I think it's a time for me to say goodbye to you. So thank you for your patience hearing. So please excuse me because of some technological snag, it was delayed for 1 more hour. So thank you for your patience. So my goodbye to all of you. Thank you.